Soft tissue. Mobilization, enhancing athletic performance and daily activity. Soft tissue mobilization encompasses various techniques aimed at improving tissue quality and responsiveness. These methods are valuable for athletes and individuals seeking to enhance their physical well-being. These techniques can be instrumental in the healing process. While exercises, stretching, and strengthening are crucial components of rehabilitation, addressing the underlying tissue quality is equally important. When tissue is restricted or unhealthy, it may not respond effectively to these exercises. Many common methods, like foam rolling, deep stretching, and even some instrument-assisted techniques, may not provide the deep tissue change needed. Massage therapy, while often neurologically beneficial and providing a sense of well-being, may not address the tissue restrictions as effectively as other methods. Specific techniques, often originating from Eastern practices, such as scraping, gua sha or Graston, and cupping therapy, can create significant changes in the tissue. These methods, sometimes used in conjunction with dry needling, can break up tissue restrictions in a way that allows the nervous system and the physical structure to respond positively. This creates a window of opportunity for accelerated healing and recovery. It's important to note that these techniques are most effective when the pain originates from the soft tissue itself. If the pain is structural, these methods may not be beneficial. A skilled practitioner can assess the source of the pain and determine the most appropriate course of treatment. They can also collaborate with other healthcare providers to ensure a comprehensive approach to care. Soft tissue manipulation techniques. Soft tissue manipulation encompasses a broad range of hands-on techniques used to address restrictions and imbalances in muscles, tendons, ligaments, and fascia, the connective tissue that surrounds muscles and organs. These techniques aim to improve tissue quality, reduce pain, and restore proper function. Soft tissue manipulation techniques. Many resources are available online and in print that detail various soft tissue manipulation techniques. These PDFs can serve as valuable references for practitioners and individuals interested in learning more about these methods. Soft tissue mobilization Physiopedia. Physiopedia is a valuable online resource that provides information about various physiotherapy techniques, including soft tissue mobilization. It offers a comprehensive overview of the principles, applications, and evidence-based practices related to these methods. Soft tissue mobilization physical therapy. Soft tissue mobilization is a common component of physical therapy treatment plans. Physical therapists use these techniques to address musculoskeletal conditions, improve mobility, and reduce pain. They are trained to assess individual needs and tailor treatment accordingly. Soft tissue mobilization versus massage. While both soft tissue mobilization and massage involve manual manipulation of tissues, they differ in their primary focus. Massage often emphasizes relaxation and general well-being, while soft tissue mobilization targets specific tissue restrictions and aims to improve function. Soft tissue mobilization techniques are often more targeted and may involve deeper pressure than traditional massage. Soft tissue mobilization versus myofascial release. Myofascial release is a specific type of soft tissue mobilization that focuses on releasing restrictions in the fascia. Fascia is a continuous network of connective tissue that extends throughout the body. Restrictions in the fascia can contribute to pain and dysfunction. Myofascial release techniques aim to lengthen and release these restrictions. A specialized soft tissue manipulation technique used to ease pain. Various specialized soft tissue manipulation techniques exist, each with its unique approach. One example is instrument-assisted soft tissue mobilization, IASTM, which utilizes tools to enhance the therapist's ability to detect and treat tissue restrictions. These techniques can be particularly effective in addressing chronic pain and improving tissue mobility. Soft tissue mobilization near me. Many healthcare professionals offer soft tissue mobilization, including physical therapists, chiropractors, osteopathic physicians, and massage therapists with specialized training. Searching for soft tissue mobilization near me can help you find qualified practitioners in your area. Soft tissue mobilization tools. Various tools are used in soft tissue mobilization, including foam rollers, massage balls, and specialized instruments for IASTM. These tools can assist in applying pressure, stretching tissues, and breaking up adhesions. The choice of tool will depend on the specific technique being used and the area being treated. Soft tissue techniques for the quadriceps muscles. This article outlines some soft tissue mobilization techniques focusing on the quadriceps muscles, with additional considerations for the iliotibial, IT band, and tensor fasciae latae, TFL. The rectus femoris, part of the quadriceps group, is often a muscle that becomes tight and shortened. It originates on the pelvis and extends down, crossing the knee joint. The TFL, located on the outer hip, connects to the IT band, which runs along the outside of the leg. The IT band itself is incredibly strong and difficult to lengthen. Therefore, treatment often focuses on the TFL muscle that connects to it. The following techniques emphasize active release, where the patient actively participates in the movement. The therapist applies pressure while the patient moves the affected joint. Techniques. Quadriceps mobilization. The patient starts with the leg extended. The therapist applies pressure along the quadriceps tendon and asks the patient to slowly bend the knee. The therapist glides their fingers along the muscle as the patient moves, gradually working up towards the origin of the rectus femoris. This process is repeated, increasing pressure with each repetition. Care is taken to respect clothing boundaries. Lateral quadriceps, vastus lateralis, and medial quadriceps, vastus medialis, mobilization. The same gliding technique is used, focusing on the outer and inner portions of the quadriceps muscle. The therapist adjusts their hand position and angle to target these specific areas. Modified muscle energy technique, PIR, post-isometric relaxation. The patient isometrically contracts the quadriceps against resistance for about 10 seconds. This is followed by a period of relaxation, during which the therapist performs the gliding technique as the patient bends the knee. Reciprocal inhibition, RI. The patient activates the hamstrings, the muscles on the back of the thigh, while the therapist glides along the quadriceps. This utilizes the principle of reciprocal inhibition, where activating one muscle group can help relax the opposing group. Concentric contraction technique. The patient actively shortens the quadriceps muscle while the therapist glides along it. Knuckle technique. The therapist uses their knuckles to apply pressure and glide along the quadriceps as the patient bends the knee. The movement originates from the shoulder, not the wrist or elbow. Forearm technique. The therapist uses their forearm to apply broader pressure to the quadriceps while the patient bends the knee. The angle of the forearm can be adjusted to target different areas of the muscle. IT band and TFL considerations. While the IT band itself is difficult to lengthen, the TFL can be addressed with similar techniques. It is generally recommended to treat the TFL before addressing the IT band. These soft tissue techniques can be valuable tools for improving muscle function and flexibility. It's important to seek guidance from a qualified practitioner to ensure proper application and to determine the most appropriate techniques for individual needs.